What particularly are you talking in terms of the toxicity? I'm slightly off skelter. Hello.
Hello. Yes, Mr. Peter, please continue. We can hear you.
Okay, so I mean, in terms of what we're seeing there, that those tend to be the main issues, and obviously it depends on the demographic of people, where people are coming from in terms of social and economic class as well. So there is definitely difference in use. Marijuana use is extremely heavy within the adolescent age group. And generally people, particularly at the moment, I'm working in the UK at the moment, and actually moving back over to Mumbai in next month to facilitate a new centre. But here in the UK, generally what we're seeing is the use of marijuana, which is widely used and actually is more decriminalised now. But obviously is still actually illegal in the UK, but decriminalised. But it's widely an issue. The use of heroin is not as high in the adolescent age group that we see. It tends to be alcohol, likewise with marijuana, and as I say, nitrous oxide seems to be quite a big issue as well that we're seeing. Same goes for Thailand in terms with the adolescent age group. If we're looking at the sort of higher socio-economic group of adolescents and what's being used, it tends to be marijuana, alcohol. Nitrous oxide is very popular again within the expat community, and we're also seeing the use of yaba and crystal methamphetamine, which are obviously significantly big issues within Asia. I'm not sure what else I can add at this point.
Thank you, Mr. Martin Peter, for your point of view. Now, I would like to request Mr. Farman Ali, please, would you like to reflect your opinion about this topic, youth and drugs cleaning up the toxicity?
Assalamu alaikum and good afternoon, everyone. Are you listening? All of you?
Yes, we can listen.
Okay. The topic you suggested is really very attractive, and it's the need of the time. Drug addiction or drug abuse is not a specific problem of a specific population, but we observe all the time in our clinics, in all colleges and universities, that our youth is evolving day by day. If we calculate the number of youth involving in the drug abuse, I think it is impossible right now, because we have a study conducted in 2011 or 12. After that, no study, no evidence is available. But we oftenly listen or read on newspaper or news that 45% of our students, 40% of our students are involving in drug. It is right or not right, but the problem, the alert, the risk is always there. If we look into the reason they are taking, our students or youth taking drugs or substances, it has many contributing factors, many issues. Most of the client coming to my hospital, they are having a different reason for drug taking. One of them is a strong peer pressure. Second is a workload performance. Some students are claiming that we just keep on taking to boost our energy. And the most commonly drug of abuse in Pakistan among students, youth, are marijuana, and the most emerging drug, ice, methamphetamine. No one can ignore, as a citizen of Pakistan, that if we don't take any response, national response, the problem will be magnified for many fold. I suggest that if we are sitting over here for calculating the problem, we are calculating the number of affected people. It makes no sense. Now it's the time to come up, to sit together, and to make a national plan for eradication and awareness at the university level. I have a plan which I had shared with my ministry, and I made a claim that initially I can work with a university, because the university has the infrastructure, the manpower, the system. So it is not so easy, but not impossible. My suggestion is to not calculate the problem all the time, that it is happening, it is happening, it is happening. It will make no sense. Now the time is to take action in a proper direction. Thank you.
Thank you so much, Mr. Famanari, for your valuable comments. Indeed, it's a need of a time for the this liaison, to establish this liaison between the anti-narcotic force and the academia to work for this very core issue of the youth. So now I would like to request Ms. Rashida Esniazi. If you are with us, please share your opinion and thought about this issue.
Thank you, Iram. A very good morning to Martin and good afternoon to everybody around. And if there are few from the other time zones, then good afternoon. Huh? So what I have for this today's activity, where you title is as youth and drugs cleaning up the toxicity. This is not easy. I have to be very honest here. This is not easy, and we have to work collectively, as Mr. Furman said. What I have for next 3 minutes to 3 to 5 minutes, what I have for you is some of the facts which I'm carrying with me, and some of the what we have now, the current situation, and what is the future. So, Mr. Farman just alluded to one of the studies, and I'm happy to present some of the key findings of that National Drug Use Survey, which was conducted in 2013. And it talks about 6.7 million have used the drugs, any illicit substance used in the past year, and 4.25 million are considered to be the drug dependent. So that's quite alarming number, and this is the data from 2013, which means it has gone high. And what they are taking both plant-based and medical prescription drugs, cannabis, the opioids, the painkillers, tranquilizers, sedatives, and opiates, that's heroin or opium. So this is the data we have. Then what is available? And it's quite alarming. And I can tell you this number has gone high. I'm sure it's not towards the downside. What is available to work on this toxicity is there as the prevention sciences. And prevention sciences is a product of the 20 years work where they tried to understand better what makes individual vulnerable to initiate the use of substances. So this there at the international standards on drug use preventions are available. It's a big tool which talks about the various stages of life, starting from infancy up to adulthood, and it talks about the various settings: school, family, workplace, community, media, So this document is a wonderful document, and I would invite everybody to have a read through it, because this talks about the various characteristics and what works in certain ages and what doesn't work in certain ages. Based on that, this document, the international standards, the objectives for the prevention have been made, because we have to be very clear. And I am sure that few people will definitely disagree with me that the objective of the substance use is to avoid or delay initiation. So in this world, we cannot stop where everybody comes up with this one that this is my will and this is my life. So the primary objective is to avoid or delay initiation so that we can avoid the development of any disorders, that's the dependence and other comorbid disorders, and very importantly, healthy and safe development of the children and youth to realize their potential and to become a contributing members to their society and the community. So, delay initiation, avoiding development of the disorders, and healthy and safe development to recognize the potential. These are the three objectives which this prevention sciences carries. And this help us to contribute towards the positive engagement for the children with their families, educational institutes. Am I audible? Because I got a comment that check your sound speaker. Is it the voice is okay?
You're audible to me properly, and some of the other participants are also reflecting that
Okay.
they can hear you.
Okay, great. Thank you. So I know it was not for me, but somehow it it puts your alarm on that it's there. Okay, so then this objective, very clear objectives of delay initiation. I'm repeating it for the third time. The delay initiation, the avoiding the development of the disorder, and to help to recognize their potential. These are the important prevention aims, and there the risk factors comes into play along with the protective factors. The risk factors, we all know it, the science has proved it: the genetic disposition, the personality traits, presence of any mental and behavioral disorders, the family neglect and abuse, poor attachment, social norms, that all, and then environment for the conducive to substance use. These are the risk factors. And at the same time, those protective factors are also there, where caring and effective parents, attachment to the schools and the communities, and personal and social competence, emotional well-being, these are all the protective factors, and that all plays a role. One thing, to clean up the toxicity, we all have to keep in mind that no effective prevention intervention, policy, or system can be developed or implemented on its own in isolation. We have to work collectively on a health centered and balanced system approach where the law enforcement has its role to to reduce the supply, treatment of drug use disorders, and reduction of the risk for associated with the drug use. We all know HIV is one of the people with HIV. They have been into drugs. Overdose is also there. The future, that's very important. The future, my duty, yours duty, is to increase the protective factors, to decrease the risk factors. And this all can be done with the very, I would say, being insightful of what we are doing with our children, how we are acting, how we are behaving in our family. We being adult, we carry the responsibility there. And then the science says, and I can tell you there, now we are talking with the university students. And believe me, this university students, the university life is really the intervention time. You can't do much of the prevention, but somehow we have to intervene there. The science of prevention says any kind of prevention activity should be introduced at least 2 years before the initiation of the drug use. So for example, if we think that in certain community the children are starting to take the drugs at the age of 10, then I think the age 8 years or 7 years is the best time where we should introduce the drug prevention programs. In the universities, I think it's the intervention level and their brief interventions, which we all are offering all the universities, but it has to be more systemized. It's one-to-one counseling, utilizing motivational skill interviewing, the mentoring, the entertainment venue safety, that all is there. And today I received a comment from my colleague sitting in Vienna that do we really have the entertainment venues? Yes, do have. Maybe in Europe, the entertainment venues are different, but we have our entertainment venues. Like in Qaidazm University, I can talk about your university, all the food places are the entertainment venues. The biggest one, all the kokas around, all the tea stalls, these are there. So the facts, what is there, and the future. And to sum it up, to clean the toxicity, we need integrated approach. We need policy. We need legal framework. We need coordination among the multiple stakeholders at national, subnational, and local levels, and a commitment to provide the resources which will help us to at least address this toxicity. So thank you very much.
Thank you, Ms. Rashda. You really draw our attention to the very important points about the risk factors that exist in the surrounding of the youth for the drug use. Thank you. Now I would request Ms. Christina von Sperling-Afridi. Please give us your precious opinion about this topic and issue. How would you look at this thing, all related to the youth and drug?
Hello, good afternoon, everyone. I just want to say, well, first I would like to introduce KKWF. Karim Khan Afridi Welfare Foundation is working on prevention on youth. And the 5 pillars that we stand on is primarily drug awareness in education institutions, being a school, college, or universities. And second important, it's environment, then sports, arts and culture, and civic sense. These are 5 elements that we combine, and every activities that we do, they are together. I'd like to also tell you our involvement with the government in pushing the implementation of the existing policies, and as well to create and regulate the rehabilitation centers in Pakistan, which has been obviously a lot of them a big quackery, exploiting families and not getting any result out of it. So no preparation, no technical team, no proper establishment. So it is a disaster right now in the reality of Pakistan in rehabilitation. So I'd like also to talk about apart from that, that we are trying to push the implementation of good policies, that is existing policies. We are also part of the task force on mental health and drug abuse of the government. So for the first time, they are trying to really to get a consensus and you know, they stop the stigma to deal on these issues. As you know, we live in a complex society. We do not like to talk about problems. And certainly every family near or far has a problem of drug addiction. And but we do not like to address this. I must say that the KKWF was the first one of civic society that opened up a dialogue with the society. That you know, the monster is there and we have to tackle. One of the problems also that we are dealing is not to be able to quantify, because in a technological era, we cannot refer to data of 2013. It's just non-existent. I mean, it's like how you are going to quantify, to be able to address better a problem without not having the number. Everything is just a guessing thing. So this is wrong. And this is something that it should be a priority of the government to exactly know, because the numbers are increasing by the minute, unfortunately. So we are right now on prevention. We are training teachers, which I think it is going to be of a good interest for the psychological department of the Karyazam University, which we have been already, we had met before, and so I'll talk about this. It's called Unplugged. This is an European Union scientific-based teachers training course on drug prevention in schools. For the moment, it's of course addressed 10 to 14 years old. And we are doing this teachers training. We have our master trainers coming from abroad, from Belgium, more specifically now, and various classes that we have to teach critical thinking, life skills, because I believe that teaching and doctors, teachers and doctors should be updated themselves all the time, because there's no point to have only the knowledge and not knowing how to pass. So kids are rapidly changing their way to absorb information. So therefore, the teachers had to be updated as well to be able to transmit the knowledge and keep the attention to the students. This, I talk about the lack of data, but I would like to talk also about the bigger role of the psychologist department. We have been there before, and this is also on behalf of the psychologists. I've been discussing with the government as well, and that has been partly some schools had implemented. That is the necessity to have in every education institution a council. So this psychologists, this will increase the scope for the psychologists of jobs in the market, and give them the equal importance that is the psychiatrist. Right now in Pakistan, the psychologist is an assistant of the psychiatrist. This is a very wrong way of putting things. So I think they are in the same level. I mean, different stages of the patient to approach, but 4 years academic of each one of them. So they are equally important. They have the equal importance in the society. So this is what we are trying to do is that every school should contract one psychologist as a counselor. It's where the first step where you're going to identify what is wrong with the students, you see, and how can you, from the beginning of the problem, you will solve. And I'm sure that this is a great step, that if every school succeeds to put a psychologist, and we are working on not only on the big schools. Right now, this education, this Unplugged that we have culturally adapted called Hum Saath Hai, it's for, right now, as it is sponsored by the European Union, it is for underprivileged schools and for independent schools. So we are reaching the grassroots level. That's what we want. And then, of course, the big schools, they will be contracting the graduates of this Unplugged later on. So Urdu program also we are doing. So this prevention for us, that's what we do. But this is, I think that it's the vision, is the way that should be. You have to prevent something to avoid to have, as drug does, I mean, HIV, and overloading all the consequences of the addiction, overloading the public health system, which is not fair. So right now we deal with the data given by the at that time the Director General of Anti-Narcotic Force, which is 8.9 million drug users in Pakistan. And this we are talking about 2016. So we are in 2010, 21. So this is a very rampant problem, of course, that I think that we have to be prepared for all this, but the focus in prevention should be much bigger to avoid this toxicity, which is rampant there. But our motto is that helping the youth to understand, identify and understand and manage emotions. This basically is the base that I think that the youth should understand. And shall disagree a bit with Rashida that food is not entertainment, Rashida. Cokers are distributing drugs close to the education institutions. And entertainment is much more. Pakistan right now has 135 million below age of 30. And if we remember what we had sent to the Olympiads, 10 athletes out of the enormous contingents that we have, that we can put 10 countries, a population of 10 countries, 135 million, 65% of the population of Pakistan, we had sent 10. So it means that sports is not an education institution, had failed on sports, and the government as well had failed to implement its own policy because it's compulsory. So it means that we shall now consider food as entertainment. It's physical education that will stimulate your good kick, which is endorphin, that makes you powerful, makes you positive, and take the stress at bay. So that's what I have to say for the beginning, but otherwise I can talk for hours. So
thank you, Christina. Thank you. I know that you can talk about this a long time, but the point is that we are with the short of time. So I will request our panelists to please stick to yourself with the time. I know that's a difficult, but now I would like to now invite Dr. Naeem Aslam to please give your opinion about this very core issue of youth, about the drugs and its toxicity. Dr. Naeem.
Dr. Sab, you're on mute. Please unmute yourself.
Dr. Naeem, आप सुन रहे हैं? Can you hear me?
Yeah, thank you, Dr. Iram. Thank you giving me opportunity to talk about on this very important issue. As most of the panelists describes and very well said, the drug abuse position as one of the most exorbitant and devastating social and medical problems of the 20th century. It is a major global concern, including Pakistan. And according to the report of the UNODC, about 275 million people used illicit substance worldwide at least once in 2016, while 31 million people suffer from substance use disorder. And these are those people who need treatment, health care, and social care and rehabilitation. And in terms of the diagnosis, from DSM, we say that it's a clinically significant impairment in daily life or distress, and level of severity is assessed on the continuum from mild to severe. While in ICD-10, SUD, the SUD is defined in harmful use and dependence syndrome. Now I would talk on Dr. Rashida has very well expressed about the overall statistics in Pakistan. I would just talk about the risk factors. Certain risk factors for substance use have been identified, especially among the youth, and that include the mental health problems, childhood adversity, sensation seeking, peer substance use, poverty, easy availability of the substance, and vulnerable environment. In addition, according to the anti-narcotic force, they have identified some factors that are responsible for rise of substance use in Pakistan. These are the availability of drugs at very low prices, economic frustration, parental negligence, lack of drug education, and apathy on the community leaders in responding to the drug abuse. However, on the other hand, some researchers have suggested that physical, emotional well-being, emotional regulation and coping skills, involvement and monitoring of parents, secure neighborhood, Physical safety, social inclusion, and quality of school environments are the protective factors among the youth. And similarly, now I would suggest some things that can mitigate this issue. That is the awareness and education regarding the drug among the youth. For example, some training sessions can be initiated among the youth, especially among the university students, and the topics maybe include overview of the common illicit abuse drugs in Pakistan, and similarly the psychopharmacological effects of psychoactive substances, stages of addiction, progression and relapsing nature of disease, common co-occurring medical and mental disorders, and similarly these awareness sessions will helpful in raising awareness among the youth. And moreover, for the professionals, UNODC and with Colombo Plan, they have initiated some courses. For example, universal treatment curriculums that are very helpful, and professionals who are involved in the drug treatment centers, they may get benefit from training these sort of courses. And at the end, at different educational institutes and in the university settings, screening and brief intervention can be introduced. For example, drug addiction for screening assist. I am just talking about a scale that is very 3 to 5 minute administration, and that give a quick review and the overall feedback of a person, and we can screen whether a person is in a problem or not. And after the assessment of based on the screening, we can do the detailed assessment by using the addiction severity index like scale. And if a person we think that he is susceptible or vulnerable to drug, brief intervention script can be provided to those persons who are moderately or and are high risk of addiction. And last but not least, religiosity is one of the factors that have been considered to protect the people from substance use and help in recovery process. So the component of Islamic and moral teachings can be integrated in the drug prevention and treatment evidence-based programs. Muslim scholars can help in raising awareness among the masses about the drug abuse. In addition, school-based drug abuse prevention programs across community that involve both parents and students will be helpful. So these are some of the suggestions that I may think that would be helpful. So that's end from my side. Thank you very much.
Thank you, Dr. Naeem, for highlighting the different psychosocial risk factors and the need for the sake of an awareness and training among the youth. So now I would move on to Ms. Sidra. Please join us and share your opinion about this very core issue of the youth. Ms. Sidra.
First of all, thank you so much, National Institute of Psychology, for conducting a very productive discussion on youth and drug abuse. As a chairperson and clinical psychologist, in my opinion, drug addiction or drug abuse has become a worldwide problem in modern times, especially in the COVID era. The ratio of addicted youth has increased manifold in recent years in Pakistan. The excessive use of drug is badly affected the physical and mental health of the youth, making them unable to perform well in their studies. Before moving on the topic, I would like to discuss about what are drugs. Basically, drugs are a habit-forming substance which is taken pleasure or excitement. And as we are talking about youth and teenagers are basically most prone to drugs because they are more prone to become victims of drug abuse because youth like activities that are associated with pleasure-seeking behavior. And youth is a name of energy, either physical energy, psychological, social, or emotional. And when we don't channelize their energies, then we will see, they will involve in negative activities like drug abuse and so on. Now the question is, why are the educated youth is restoring to the drug abuse? According to my point of view, there are multiple reasons. As all the panelists discussed very briefly about the physical, psychological, social consequences of the drugs, I would like to highlight the family perspective or social perspective of drug abuse and youth-related problems. In my opinion, academic pressure is one of the such causes that is taken by the youth when they are under demand of the time and energy in order to meet educational goals. The second point is parents' our expectation from their children to perform well in studies and achieve good grades to excel in the chosen field is one of the main factor uh, for youth. In order to take relief from the stress of above mentioned pressures, the educated youth find an easy shelter under the umbrella of drugs. Lack of proper counseling has its own place in this dilemma as the youth has no one to guide them in the right direction towards a better future. So, in my opinion, counseling centers should be developed in all the educational institutes so that they can guide our youth in positive and productive direction. Drug is quite easily available in the educational institute. There's some statistic related to crystal meth, and these are a drastic increase in the consumption of synthetic narcotics like crystal meth or ice has also been reportedly. Initially, the use of crystal meth was mostly restricted to urban youth, but now its consumption is more widespread. For your information, in Pakistan, you can find ice or crystal meth only in 50 rupees. So this situation is very alarming. Law enforcement agencies need to do something to seize drugs, shipment, and arresting dealer so that our youth have lesser availability of drugs. The second point, which I just want to add in this is there is a very productive role and very positive role teachers and parents can play. Parents should play their active role in the managing the future goals of their children because they are the first one to help their children develop a positive self-image and create healthy approaches towards a life with confidence and determination. The second point is taking care of their children, future aims and objectives. Parents can help, parents and teachers both can help and guide them in the selection of their right discipline that will help them in the getting appropriate jobs in the future. They must not apply pressure. Actually, pressure is applied on youth by their teachers or by their social pressure is very common on their children. That may lead to the anxiety and stress-related problem. Uh, they should guide them through proper counseling in setting future goals and must encourage them towards achieving their dreams and goals of life. Uh, Educational institutes and teachers can play a very effective role in controlling the menace of drug abuse. They should shoulder this responsibility sensibly and must take initiative to eradicate the evil of drug addiction from the life of the youth. Education must be provided at educational institutes about the consequences of alcohol and drug use. Teachers have very productive role and very positive role. Teacher can also play their constructive role in this regard. They should guide and warn their student against the disaster impact of drug abuse on their physical, mental, social, and academic well-being. Apart from this, additional options such as games, as other panelists discussed in very detail, physical activities are very important for our youth. Like games, sports, individual counseling must be offered at educational institutes under the guidance of trained health educational or mental health instructor or experts and professional counselor. Coordination, weekends and campaign must be carried out to create awareness among the students regarding the negative impact of drug use. Parents and teachers hold a very significant place in the life of their children. The better the relationship between parents and children and teachers, the better the children or youth physical or social and emotional well-being can be. Teachers are the role model for their children or youth, and their activities cast direct influence on the overall development of the youth. If the relationship between parents and children is positively and healthy, youth feel secure and able to perform well in every field of life. On the other hand, if there exists a communication gap between the two parties, then children find escape from such unhealthy relationships, and they may indulge in a negative activities such as drug addiction and other activities. So that is from my side. Thank you so much for listening.
Thank you, Ms. Sidra, for highlighting this very important thing that there should be a liaison between teachers, parents, and the academia should be, taking an active role to having the counseling center to work for this, for our youth to prevent them from this drug use. Now, I would like to request Mr. Fiaz. Please, Mr. Fiaz, give us your opinion about this very core issue of youth, about the drug use and its toxicity. Mr. Fiaz.
Thank you so much, ma'am. It is really a stunning topic, and really it is the need of the time and need of the society as well. Because if we look on the report of the UNODC worldwide, we come to know that in 2009 there were 272 million substance users in the world, right? And in 2021, the number of the substance user is increased to 255 million per year. So it means that every year the number of the substance users are increasing in our society, right? Similarly, if we talk about the perspective of Pakistan, uh, uh, what if we mute a mic, please? Thank you, miss. There is distortion in the mic in this now. So I was talking that with the Pakistani perspective, if you look on the reports, there are 6.7 million substance users who were reported in 2013. And similarly, in 2016, they are increased to 8.9 million. So definitely the population, if you look at the age range of the reports, it varies between 15 years to 64 years, which means that the youth are at the high risk of the substance use. Because if we look at the percentage of the youth as compared to the later adulthood or the later adolescents or the old age people, you would come to know that the youngster people's the age range and the percentage in the population is 65%. So when we talk about the youth, it means that we are talking about the 65% of the population. Definitely it is at risk. So it's a wonderful topic, and I feel that it is not only the responsibility of a single person, it is the responsibility of the every member of the society, because we are living in this society and we know others who are using the substance. If we are going to counsel others, if we are going to let others know, and if we are going to convey the message on the right time before the onset or during the onset, because every substance user has to progress in different stages. There is a time when every substance user is just a user, and then he becomes with the passage of time he becomes abuser, and at the last he become dependent or he become addictive to it. Like for example, if anyone amongst us who see anyone who is using a substance, we can take certain initiative to talk to him or to talk to his family or even to consult someone so that we could reduce this number. So definitely there are different interventions, different programs which can help you to reduce the number of substances. Like for example, right now you can consult different rehabilitations in Pakistan, and even there are different training programs which are being organized with the mutual coordination of the teachers and with the mutual coordination of the therapist, and different organizations are putting their works for the future. So I feel that it is one of the important topic for the youth as well, because youth is at risk right now. And we used to say that the future of the Pakistan is in the hand of the youth, but actually our youth is on a wrong track, and there are few numbers, but we can manage this disease. And I hope that by organizing such seminars we can reduce these numbers. Thank you, ma'am.
Well, thank you, Mr. Fiaz, for your valuable comments. If I conclude that I found it that 65% of population of the youth in Pakistan you highlighted need to be addressed with reference to the multiple issues, including the drugs, and there is dire need to initiate the multiple, the programs, creating the awareness and initiate the different intervention programs. Thank you. for all the panelists for their overall feedback and the comments about this very core issue of the youth. At first, I would like to say thank you, Sir Farman Ali, for your points and information regarding these statistics and other, the important concerns regarding the drug use that are really valid that you highlighted in the chat box. Thank you so much. So now we will move to the round two, and it is based on the question answer session. So I will request to everyone to be very quick for the review and the feedback and regarding the questions, and kindly be as precise as possible. So at first, I would like to ask the question from Miss Christina, as you highlighted the certain, the facts and certain statistics and the figures with respect to the Pakistan about the drug use and the multiple issues that are regarding the legal and with respect to the psychologists. So how would you look into the things that what are the gaps, that are hindering to work for the collaborating, the efforts with respect to the academia, and you can say the psychologists and the legal point of view, and with respect to the governmental agencies? Christina, please unmute your mic. We can't hear you. Your mic is mute.
Sorry.
Thank you.
First
Thank
of all,
you.
we have to, the society have to understand, the community, that this is a problem. There's a real problem. And so we should stop to try to hide this kind of, hide and stop to address. So, problem to, yes, the community is not demanding exactly more from the government, that the policies that are all to contribute to the community not being implemented exactly. For instance, when you talk about entertainment, that what the youth needs the most, this physical education that we are talking, it's a scientific basis, nothing that I'm talking, not just of my own impression. But if you get physical engaged, you will develop a good hormones, which is endorphin, which will make you positive. What is the characteristic of the adolescence? It's always creating some problem. And plus, living in a complex society, which the youngsters, they need more to obey. They are not allowed of critical thinking. So this creates a conflict together with, of course, the havoc that's going on inside each one of the adolescents right now. So it is dialogue, it's talk, it's try to understand oneself, the others to understand what is going on, to remember what we had passed while we were adolescent ourselves, the time of insecurity, and especially now that, you are influenced in so many ways with the technologies. You have your peer pressure, you have influences everywhere. So how do you do this? There is nothing but start a dialogue, open up, give chance to the youth to have an opinion. And on the psychologist, again, I would like to emphasize that we are underusing this profession, which is critical and so important to the community, to the society, that they start to understand before you start to prescribe opioids or other things. And at least, you can understand the problem at the beginning. So this is a topic that, as I say, we can make a short answer, but there are solutions that can be followed. And primarily you can start to implement the policies that already exist, that will do a great good to the society.
Thank you, Ms. Christina. Thank you. Now, I would like to ask Mr. Farman Ali. Sir, you highlighted the multiple things, with respect to the drug use. So, what do you think? What is lacking in our social system that is making our youth so vulnerable toward the drug use? If you are with us, Mr. Farman.
What was your question?
I was just I wanted to have your opinion about what do you think that what is lacking in our social system that is making our youth so vulnerable for the drug use? Because you highlighted the many factors about the influences that are, psychosocial influences that are creating their impact on the youth mental health overall, and specifically with reference to the drug use. So, how would you say that that our social system is they're having so much gaps? So what do you think, what are those gaps so our youth is so distracted?
Ma'am, if we would like to go into detail, our national anti-narcotics policy is very, very comprehensive. Each and everything clearly mentioned there. But unfortunately, very sadly to say, that the national anti-narcotics policy emblematic partners are not interested in a important national issue. So I would say that the implementing partners of the national anti-narcotics policy should be implemented in a manner. I always keep on saying that we sit together and calculating the problem, this is causative factor, the reason. Ma'am, it makes no sense. It is the time to not to calculate the problem, but respond the problem, because the problem magnitude is so bigger than the national responses. It is not only the responsibility of law enforcement, it is not only the responsibility of anti-narcotics force, it is a collective elaboration, collective coordination, all the stakeholders. Uh, uh, our problem is, it has been observed, then we always stop the floods. But I say that floods are not stopped, but floods are managed well in time. We are the nation, we wake up on the time. When the problem comes, when the problem destroys us, so we keep on crying. It is the high time. My suggestion is not to go into the reason, not to go in the reason from where drugs are supplied. Drug and substance are being supplied from many years. It is ANF is responsible, and the other law enforcement are responsible to control. But as a nation, as a professional, our duty is to introduce strategies. Suppose in a educational institution like Kadias University, there we empower the administration, we empower the university to launch a comprehensive strategy to clean up the environment, because and university has a manpower, university has a infrastructure. So I can make a claim that if we succeeded in launching very small, like I have mentioned over here, I'm really sure that it will work out. I again request to please, when we go into the reason, one thing you have noticed, then we say awareness makes no sense. If you asked 20 youth people, 20 students, that you have awareness that drug kills you, that drug disorganize you, then what was the reason? What was the reason that you have started drug? In Besides that have well aware, but drugs are being taken or using. Mm, I mean, uh, uh, in a many way, many reasons. So I again request all the participants, the stakeholders, to come up with a strategic plan. We must have national strategic framework, and inshallah, I am very hopeful if we keep on making some strategy, the results will be very visible and fruitful. Thank you.
Thank you. Thank you, Mr. Furman. Now, I would like to ask Ms. Sidra, you highlighted the multiple points with respect to the communication and the pressure that exists between the parents and the children. Can you bit highlight how can the parents and the children, can improve with respect to the better communication, so parents can put an effort in this regard, so the children do not feel much pressurized, so they will not have that much stress, and they will not be dragged into the drugs. If you are with us, please, we would like to have your opinion on it.
Thank you so much, Him. Uh, while it's impossible to prevent anyone and everyone for using illicit drugs, there are things we can all do to avoid drugs and any type of abuse, drug abuse, by sharing knowledge with those closest to you, like your friends, your family member, your community members. Number, there are 5 points which I'm going to share with all the members over there, so that they can learn from this platform, and this information is spread on the level of the community or social level. The first technique is effectively deal with the peer pressure, because we are talking. Biggest reason youth start using drugs is because their friends utilize peer pressure. No one likes to be left out, and teen and some adults too find themselves doing things that normally would not do just to fit in the society. In these cases, you need to either find a better group of friends that won't pressure you to into doing harmful things like drug addiction or so on, or you can need to find a good way or a good company to say no. So learn to say no. The first point is learn to say no and effectively deal with the peer pressure. The second point is deal with the life pressure. People today, and especially youth, are overworked and overwhelmed, or often feel like a good break or reward is deserved. But in the end, drugs only make life more stressful, and many of us are too often fail to recognize this in the moment to prevent using drugs as a reward. Point other way to handle stress and unwind, take up exercising. There are multiple good and positive activities, like you can exercise, read a good book, volunteer with the needy, do social work, create something creative, anything positive and relaxing that can help take the mind off using drugs to relieve stress. The third point is seek help for mental illness. Uh, there is a big taboo and big stigma is related with psychological health, especially in Pakistan. लोग क्या कहेंगे, पागलों के doctor. So mental illness and substance abuse often go hand in hand. Those with the mental health illness may turn to drugs as a way to ease the pain. Those suffering from some of the mental health illness, such as anxiety, depression, PTSD, and should seek the help of a trained professional or a clinical psychologist or psychiatrist before it leads to the substance abuse. The fourth point which I'm going to share is examine every risk factor present in your environment or in your society. If you're aware of the biological, environmental, and physical risk factor you possesses, you are more likely to overcome them. A history of substance abuse in the family, especially living in the social setting that glorify drug abuse, especially in Islamabad, Rawalpindi party culture is very common nowadays, and youth feel very comfortable and status conscious to move with the people. Those are glamorizing the drugs. So glorified drugs abuse and family like that models drug abuse can be risk factor. And last point is keep a well-balanced life. People take up drugs when something in their life is not working, or when they are unhappy about their lives or where their lives are going. Look at life's big picture and have priorities in order. Do physical activities and do something productive and positive, and it will help you in the future and in your well-being.
Thank you, Ms. Sidra, for highlighting the related concern in a very comprehensive way to how to help you. Now I will request Ms. Rashida, as she said that she might be leaving in 10 minutes. If you are with us, we would like to know that how the UNODC is, planning to deal with this issue. If you are with us, Ms. Rashida, if not, then I can proceed to some other question.
I am there. So
Thank
maybe
you.
you can repeat the question, Iram.
Sure, sure. Can you just you please reflect briefly upon how the UNODC is planning to deal with this issue of drug use right now? What are your projects, to be work on with reference to the drug eradication and to help the youth?
Okay, thank you, Ram. Somehow UNODC is always in advisory role where we usually do not implement our projects, but we work closely with the governmental departments, and a few of things have been said by different speakers, like Dr. Naeem mentioned about the various trainings on universal treatment curriculums, that is for the drug addiction treatment. And then I will add up to universal prevention curriculum, that is for the drug prevention, making a workforce on drug prevention. So what we have done so far, we have trained around more than 100 drug treatment professionals in Pakistan, and out of those 101, around 70% out of that 100, around 70, they got their credentials in the international uh, that's ICAP, that's International Certified Professionals Level 1. So around 70 people, they got that credential. And then out of those 70, around 46 drug treatment professionals have been trained as national trainers who are now eligible and qualified to deliver these trainings on UTC. Then on the universal prevention curriculum, we have developed a workforce of around 11 people from different walks of life, education, health, uh, ANF, and they are certified in training staff on or training teachers and other policymakers on how to develop the drug prevention strategies and drug prevention programs. And then the third one, which was mentioned, that currently what we are doing in UNODC, we are working on the standardization of the drug treatment services in Pakistan, and we name it as the quality assurance of the drug treatment. And this project is there, and we are working closely with the Ministry of Health and Ministry of Narcotics, where we have developed a mechanism that how to regularize or how to make how to apply the international standards in the drug treatment in Pakistan. And soon we are going to come up with updated national standards on the drug treatment. Now the question lies of accountability, and I think what I heard from Farman Saab, from other worthy speakers. Yes, we there are many things which we are doing. We are working on awareness. We are working on different interventions. Christina, one of my good friends, she mentioned about unplugged. There are other programs. The question comes up: accountability. Who will do and how quality work they are doing? So who is going to monitor them? Who is going to regularize them? And I think this is what is missing. One of our other speaker, Sarah, was talking about different factors. Everybody is doing beautiful work, but somehow the standards are missing. At least the minimum standards of the drug treatment should be applied. Minimum standards of the drug prevention should be applied. And to have such regulatory mechanism, this is what we are working on. And recently, we have piloted a rural drug treatment project where we try to take out drug treatment from the drug treatment centers. Because what is happening in the drug treatment centers, I'm not blaming all, but majority of the drug treatment centers are providing detox, and they term it as rehabilitation. Rehabilitation is totally different from detox. So this rural treatment has really gave us an opportunity to look at the detox and rehabilitation into two perspectives. So these are the few things which we are working, and we are planning to introduce some advanced courses on the drug treatment in Pakistan as well. And we are working to expand the workforce of the prevention professionals in Pakistan as well. So let's see how we are moving slowly, and you can imagine working with the government is not that easy, but we are trying to take our part. So that's it from my side. I hope I have answered.
Thank you, Ms. Rashta. Indeed, you highlighted the very important thing that we are interested, that we wanted to know that how, the UNODC, as you highlighted, that it's an advisory role and trying to work and establish the liaisons and working with reference to its legislation and other things. Thank you so much. So I would request now Mr. Fiaz, if you are with us, you highlighted the multiple things with reference to the drug use among the youth. Can you be highlighted with respect to the research, as I know that as you are planning your PhD research in this area as well, that can help the youth, with the deal, youth and parents and all the stakeholders to deal with this issue. So what's your opinion about that as a clinical psychologist? Fiaz, if you're with us.
Yes, ma'am. Thank you so much. Yes, ma'am. Definitely, I'm planning a research, and that is basically on the neurofeedback and CBT and mindfulness. We are actually using these treatment approaches in our research to confirm that what are the evidence-based researches and what how these researches can reduce the number of the substance user. It is the first thing. And most importantly, what I feel that it is as I said earlier, that it is the responsibility of the everyone. Like for example, if you look in our society right now, and if you compare it with the back, I want to say that with 1990s or 1992, if someone was using substance, he was having fear of his uncle, of his surrounding, of anyone in the society, that he would see me and he would tell to my parents, and he's going to inform to my parents, and it would be humiliating for my parents and things like that, right? So right now the peoples are damn cared for such other for the use of the substance. Like for example, if anyone is using the substance in front of anyone, no one is going to talk to him. The person who is using the substance and the person who is watching them, he will just cross to him. He won't say to him. So it is the shift of the society, it is the shift of the paradigm. Right now we are facing this problem. So we have to consider it, that we have to work on it, and we have to take our role, and we have to play our role in our society. That if we see anyone who is using this substance, we have to talk to him, we have to talk to his family, we have to find the ways that how we can guide this person so that he could stay in this sobriety. It is the one. Second thing is that if we talk about the research programs in our society, specifically in the addiction treatment, we are exploring the factors, that what are the factors for the drug addiction, like role of the personality, role of the emotional intelligence, role of the social intelligence, role of the peer pressure. We have done so many researches in this way, but we have no research is conducted on this topic, that what are the effective treatment approaches for the substance users, because we know that the number of the substance user is increased, and now it is the time that we have to curtail this number of substance by putting certain evidence-based practices. And I feel that much research is needed in this era, specifically with relevance to the drug addiction, and specifically with the youth, as they are the most vulnerable people amongst the society. So this is what I feel, ma'am. Thank you.
Thank you, Mr. Fiaz. Now I would like to ask the last question from Mr. Martin Peter. Mr. Peter, I have been asked from the audience that they please ask this question to the Mr. Martin, that what intervention can be used to sensitize young individuals about, to sensitize them with respect to the toxic effects of the drug. Mr. Martin, if you are with us.
Sure, I'm still here.
Yeah, thank you.
I think it's really difficult. It's a really difficult area working with adolescent and young adult people to get the message across regarding drug abuse and drug use. And obviously, one of the things I noticed, another question actually that someone had mentioned about, why do you think there's an increase in more uptake and use of drugs? And I think this stems a lot also from sort of how society has changed over the last significantly over the last sort of 15 years with social media and the need for people to have instant gratification through various different means. And I think we've become very much into a society now across the world where it's an instant gratification society, be it through using drugs, be it through getting likes on Instagram, via Facebook. Now we need to be sort of able to reach out to the young people. Look, awareness is a really important part of it, but it's not going to actually resolve some of the issues. We've got teenagers and young adults that are often struggling with various issues, and they're not really entirely sure who they can reach out to. I've heard it many times about, they feel that they might be judged, that they're worried about being criminalized. And I think, this is, criminalization of young people that are using drugs is really very counterproductive, because often what we then find is that we, condemn them to life on the peripheries. If you get a criminal record and get put in jail for drug use, then, it's very difficult in the future to maybe seek, gainful employment or to access things into education facilities. So we've got to be sort of, creative in allowing the young people to be able to reach out and speak to the professionals. And we've got the ability now, social media might be a pest, but it also can be used, for good. And hopefully we can get a message across that people can talk about why they are using drugs and what those reasons are. People are exposed. I think a couple of things that have been mentioned earlier about people being more susceptible, particularly when they're in halls of residence. I think you call that, I don't know, that's what we call them over here, in universities where there's more likely to be drugs. It's less supervised, people get bored, or they're more susceptible to peer pressure. So, we need to be in those types of areas, being able to be not seen as the police or these people that sort of trying to control them. We need to be helping them understand what's going on, that they feel that they can reach out. It's a really complex, really complex area. Again, the other part around about that is about treatment. And obviously I'm a treatment, my general field is treatment. I mean, I work in the treatment field day to day. And again, it's about having treatment modalities that are actually suited to young people. And I think, over the years, we've often seen people squeezed into a specific type of model of treatment across the board, whether they are 18, 50 or 80, and that's a significant issue. An 18-year-old has a completely different view of the world than a 55-year-old. And again, we have to understand that there is a difference between a drug user and a drug abuser and a dependent. And the younger people will experiment. So I think, we've got to be, creative in our approaches, both through treatment and also through awareness. And also, I think, from the criminal aspect around about, what is happening with police and the justice system for people that are using. It's a massive issue, and it's the same issue here. We're seeing more issues now, particularly in the UK and even in Thailand at the moment, particularly from the pandemic, where many students now have been online learning for 12 months. So they've had long periods of actually not necessarily having much supervision as well, boredom and things. So yeah, it's a really we'll see. We do need to make changes about the approaches that we take to engage this this age group.
Thank you, Mr. Peter. So I guess there is no need of the round 3, as most of our panelists address the issue in the question with reference to the suggestions and what are the possibilities to eradicate this issue from the society and to help the youth. So if I like to conclude the comments of the panelists in the end. So in today's discussion, we actually come across to know through the through the Peter's point of view about the drug preferences across the globe, and specifically similarly in Asia and the other countries. And similarly, Mr. Farman highlighted the socio-cultural factors that leading to the addiction. Thank you very much for this valuable information. Ms. Rashta highlighted the factors that are with reference to the leading to the addiction that are well taken by the and the efforts with respect to that. And Ms. Christina, she highlighted how we can engage the multiple, the people who are working in this field with respect to teachers, psychologists, and the the governmental policies with respect to that. How can we help the youth? And similarly, Dr. Naeem highlighted some of the points with reference to the indigenous reasons which are the behind of this drug use, and what are the possibilities with respect to the research that we can explore and help these the students with respect to the intervention. Similarly, Ms. Sidra highlighted this very important fact that the accessibility of the drug is so the easy over here in Pakistan, that is, it is available in such a low price over here, that can lead to that accessibility is one of the very important factor that can help you to get attracted toward the drugs and toward the more drug use. And in the light of these all valuable feedback, I would like to in the end answer, or you can say a comment that we have been asked in the chat continuously, what the Quaid-e-Azam University is doing with respect to this very core issue. So I must like to highlight that we are having the counseling center over here that is permanently available for the students, for their counseling, for their consultation with respect to the mental health issues, including the drug. And similarly, now the Higher Education Commission Pakistan is trying to implement the policy in a very in a serious way in all the universities to help the trainers how to you can help the trainers and the psychologists who are the frontline worker that are working with the drug addicts. So we are taking part of it. National Institute of Psychology is always being very active with respect to the research in this very core issue in areas, as Mr. Fiaz highlighted about his PhD research. And one of the another important factor that is associated with the stigma and the caregivers who are they are the people who are directly affected, and we should focus on the research on this. And I know one of the PhD scholar here at NIP, Ms. Namude Sahar, she is focusing on their research area in this, and there are other multiple programs that are going on simultaneously to work over it. And so thank you very much to help us to know about with reference to the different areas of working that you are involved, how we can to combine work together again, and how can we help the youth. So in the end, as we have quite taken time with respect to the panelists and participants, so I'm very thankful for your patience and presence till this time. So on the behalf of Director NIP, in the end, Professor Dr. Rubina Hanif, I would like to thank you and extend my gratitude to all the worthy panelists and participants for your fruitful panel discussion, for your precious comments, and of course for your precious time that you're still here and you contributed in this panel discussion. So we would like to end over here, though it's not an end, it's just a beginning. We can talk more and more, and we need to talk more and more about this very issue. Everyone, thank you so much again, and I'm really grateful to all my panelists. Thank you.
Ma'am,
Ma'am, one
last
Mr.
suggestion.
Kumar, you can say, please continue. You're saying something.
I can conclude as a nation that
Yeah.
know your problem, own your problem, respond your problem, and resolve your problem. So inshallah, we will able to resolve, to know, to respond the problem in a proper and effective way. Thank you very much.
Thank you so much for this wonderful thought in the end. Thank you so much. Indeed, we can resolve this issue by working all together. Thank you, everyone. Very good afternoon, rather very good evening. That's where we're moving ahead toward the evening. And with respect to the Martin, so I guess we are moving toward the afternoon.
Afternoon, yeah.
Exactly. So thank you, everyone, once again.
Thank
Goodbye.
you.
Good
Goodbye.
evening. Good evening.